Hi, and welcome to our specialized seizure training for school personnel. We are so grateful for your participation, and we look forward to assisting you as you serve and support those impacted by seizures. Would you know what to do? This training is designed to equip you with the knowledge and skills to assist someone who is having a seizure. The information provided in this training does not take the place of individual medical advice. If you have seizures or epilepsy and have questions about your condition, please contact your healthcare provider. Upon completion of this training, you will be able to demonstrate a basic understanding of epilepsy, recognize common seizure types, treatment options, and their possible impact on student learning. You will have an understanding and see the importance of a seizure action plan, sometimes called an individualized health plan, while being able to recognize when a seizure is a medical emergency and know the appropriate first aid and response. What is a seizure? A seizure is a sudden, excessive discharge of electrical activity in the brain that alters one or more of the following. It can alter movement, sensation, behavior, awareness, speech, one of those things, two of those things. It all depends on what kind of seizure it is and where it's occurring in the brain. What is epilepsy? Epilepsy is a chronic neurological disorder characterized by a tendency to have recurrent unprovoked seizures. Epilepsy is also known as a seizure disorder. Please understand that someone can have an isolated seizure that is provoked. For example, a seizure could happen as a result of taking a certain medication where seizures may be a side effect, or in the case of severe dehydration. An isolated seizure is not considered epilepsy. Seizures can happen to anyone at any time, no matter their age, gender, race, socioeconomic status, or geography. However, data does indicate that epilepsy tends to occur in younger children and older adults at a higher rate. Seizures are also common in co-occurring disorders such as ADHD, autism, and Down syndrome. Epilepsy is more common than you think. Approximately 3.4 million people living in the U.S. have active epilepsy. More than 45,000 new cases are diagnosed annually in children, and 1 in 3 people have uncontrolled epilepsy. 1 in 26 people will develop epilepsy at some point over the course of their lifetime, and 1 in 10 people worldwide will have one of those isolated seizure events. Epilepsy is more common than cerebral palsy, Parkinson's disease, and multiple sclerosis combined. Here are some additional epilepsy facts. Epilepsy is the most common neurological disorder in children, and about 65 million people worldwide have epilepsy. Epilepsy is still misunderstood, even though it's not rare. Let's dispel some of the most common myths. Did you know that most seizures are not medical emergencies? And that a student may not be aware they're having a seizure and may not remember what happened? Epilepsy is not contagious. It is also not a form of mental illness, but a medical condition like diabetes or asthma. A student cannot swallow his or her tongue during a seizure, and everyone can learn seizure first aid. Here is some important terminology that you might hear while talking to a parent who is describing their loved one's condition, or your school nurse referring to a student's seizure action plan. These terms will help you understand and identify certain characteristics of the student's seizure disorder. An aura is the actual start of a seizure and may be thought of as a warning. Ictal is the Latin word for seizure. When we talk about pre- and postictal, we're referring to the period of time before or after the seizure. Idiopathic refers to a disorder of unknown cause. Intractable is defined as being difficult to alleviate, remedy, or cure. Refractory means that a treatment option fails to achieve seizure freedom for 12 months or more. And status epilepticus is a prolonged seizure, usually defined as lasting longer than 5 minutes, or a series of repeated seizures, a continuous state of seizure activity, and this may occur in almost any seizure type. Status epilepticus is a medical emergency, and medical help should be obtained immediately. Here you will see some common causes of epilepsy. People develop epilepsy for genetic reasons, because of brain injury, infection, or tumor, a systemic or metabolic problem in the body, after a history of strokes, or perhaps the structural formation of the skull didn't form as it should, thus resulting in seizure activity. Why is it important to know seizure first aid? Because seizures can cause harm, such as cuts that require stitches, fractures, broken teeth, concussions, or a student could experience status epilepticus, which is a medical emergency, and we want to do everything in our power to protect that student and keep them safe. Seizures can also affect one's quality of life. A person with epilepsy may not be able to drive. They may have deficits in their cognitive and emotional development. They may have limitations at school or work. They may experience social embarrassment that causes them not to want to actively participate in school. They may be worried or anxious for their safety, or that an injury may occur, or if they do have a seizure, that no one will know what to do. Now let's talk about seizure types, the first being generalized and the second being partial or focal seizures. In a generalized seizure, the seizure involves the whole brain. We're going to discuss common types such as absence and tonic-clonic seizures. Those symptoms may include convulsions, staring spells, muscle spasms, or falls, whereas partial or focal seizures involve only one part of the brain. The common types that we'll discuss today include simple partial and complex partial, and those symptoms will be related to whatever part of the brain is being affected. Absence seizures involve brief, sudden lapses of awareness. An indication is a vacant stare, which may be mistaken for a lapse in attention. Other indicators might include a sudden stop in motion without falling, lip smacking, eye fluttering, blinking, or chewing motions. These generally last 1 to 10 seconds in duration. Afterwards, there's no memory of the incident and is void of confusion, headache, or drowsiness, which is that postictal phase we discussed earlier. As a teacher, you may comment about a student's inability to pay attention or that he or she is daydreaming. A decline in a child's learning may be the first sign of this disorder. With any seizure, always pay attention to how long it lasts and follow the seizure action plan if the student has absence seizures. If you observe any of these prolonged automatic behaviors, which could include moving without awareness and/or confusion, immediately report to your school nurse with possible symptoms of absence status epilepticus, as this is a medical emergency. I would also like to speak briefly to your appropriate response. Please be sensitive to the student and what he or she is experiencing. Remember, with lapses of awareness, they are missing bits and pieces of time, of lessons being presented, directions that are given, being able to keep track of what they are reading and comprehending it. They may be apprehensive to speak in class because of the way these seizures can interrupt their ability to speak fluently. And remember, every student is different in your efforts to support them. Now let's talk about generalized tonic-clonic seizures. These used to be referred to as grand mal seizures, but were renamed to better represent what happens to the body. This type of seizure is what most people picture when they think about seizures. This seizure type has two phases. During the tonic phase, the body becomes stiff and rigid as the muscles suddenly contract. The loss of consciousness occurs and causes the person to fall down. In the clonic phase, the muscles go into rhythmic jerks or contractions and is what we call convulsions. As we look at the signs and symptoms that occur, please understand that not everyone experiences the same thing. You may hear a sudden hoarse cry, or the person may scream out at the beginning of the seizure. Shallow breathing and drooling may occur. They may foam at the mouth. Possible loss of bowel or bladder control may happen. Occasionally, the skin, nails, lips may turn blue. This is a sign of a lack of oxygen. Generally, these seizures last 1 to 3 minutes in duration and are usually followed by the postictal phase, consisting of confusion, headache, tiredness, soreness, and speech difficulty. Now let's look at the first aid for generalized tonic-clonic seizures. Stay calm and track time. Protect the student from possible hazards such as chairs, tables, sharp objects, and remove eyewear such as glasses. Loosen any tight clothing or jewelry from around the neck to ensure adequate breathing. Turn the student on his or her side while cushioning their head. After the seizure, remain with the individual until awareness of surroundings is fully regained or your school nurse or emergency responders have arrived. Be sure to provide emotional support to the student and document the seizure activity on the seizure observation record. First aid for a student in a wheelchair. Do not remove the student from the wheelchair if at all possible. Secure the wheelchair to prevent movement and fasten the seatbelt loosely to prevent the student from falling out. Protect and support the student's head, ensure breathing is unobstructed, and allow secretions to flow from the student's mouth. Pad the wheelchair to prevent injuries to limbs and continue with the relevant seizure first aid protocol as outlined in the seizure action plan. First aid for a seizure with a loss of consciousness in water. Support the individual in the water with the head tilted so the face and head stay above the surface. Remove the individual from water as soon as it can be done safely. If the individual is not breathing, begin rescue breathing and immediately call 911. Even if the individual appears to be fully recovered, always transport to the hospital to be evaluated. First aid for a seizure with a loss of consciousness on a school bus. Safely pull over the bus and come to a complete stop. Place the student on their side across the seat, facing away from the seat back or in the aisle. Remind the other students to stay in their seat and remain calm. Follow school policy regarding continuing on to a destination or waiting for assistance. If you are a school bus driver, please make sure you know what your school district policy is regarding continuing on to your destination. Now let's look at dangerous first aid. Do not put anything in a student's mouth who is having a seizure. This will avoid harming them or making them choke on an object. Do not hold them down or restrain them, as this could lead to injury. And do not attempt to give them oral medication other than their seizure rescue med if you've been given the authority and training to do so, and no food or drink during the postictal phase of their seizure to ensure the student does not choke. Now let's talk about focal seizures. Focal seizures without loss of consciousness, or you may hear someone refer to this as a focal onset aware seizure, were once called simple partial seizures. These seizures do not cause a loss of consciousness, but full awareness is maintained. The student may alter emotions or change the way things look, smell, feel, taste, or sound. Some even experience deja vu. This type of seizure may also result in involuntary jerking of one part of the body, such as an arm or leg, or facial grimace, and spontaneous sensory symptoms such as tingling, dizziness, and flashing lights may occur. If a student is experiencing any of these symptoms for the first time, please stay calm, track time while immediately calling your school nurse. If the student has a seizure action plan, refer to the plan for individualized first aid. Focal seizures with impaired awareness, once called complex partial seizures, involve a change or loss of consciousness or awareness. The student will not have the ability to respond or follow any kind of direction during the seizure. These seizures often begin with a blank, dazed stare. The student may perform repetitive, purposeless movements, such as hand rubbing, chewing, swallowing, or walking in circles. They may be clumsy or have nonsensical speech. These seizures generally last 1 to 3 minutes in duration and are followed by a postictal phase, which may include being tired, having a headache, or feeling nauseated. This seizure type can be confused with drunkenness, drug abuse, or aggressive behavior. A person having this type of seizure may also become combative if restrained. Now let's look at the first aid for a focal impaired awareness seizure. Stay calm, reassuring others around you. Be sure to track the time. Do not restrain the student, but gently direct them away from any hazards, perhaps even putting yourself between the student and the hazard, such as a flight of stairs or an open door. Other precautions in a classroom might be to make sure that cabinetry is closed, backpacks are on hooks, and unoccupied chairs are pushed underneath desks or tables. Do not expect the student to obey any kind of verbal instruction and stay with them until they're fully alert and aware or until your school nurse or response team member has arrived, and be sure to follow the student seizure action plan. When is the seizure an emergency? If a student is experiencing a seizure for the very first time, or a convulsive seizure lasts more than 5 minutes in duration, if repeated seizures occur without regaining consciousness, or the student is injured, is diabetic, or is pregnant, or if the seizure occurs in water. It is also an emergency if normal breathing does not resume after a seizure, or if the parents request an emergency evaluation. Now let's talk about the things that might trigger seizure activity. Flashing lights and hyperventilation can trigger seizures in some students with epilepsy. For example, flashing or strobe lighting may be present at a school dance, prom, or musical. Fluorescent lighting in rooms where the bulbs begin to burn out often flicker, so it's important for maintenance or janitorial staff to be aware of such lighting issues. Video games, movies, or possibly a program being viewed on an iPad or computer might have flashes of light. School buses have flashing lights on top, or sounding fire alarms could be problematic for some. Also, knowing if a student is triggered by hyperventilation is important for coaches, health and PE teachers, and those supervising at recess or outdoor play. Other factors that might increase the likelihood of a seizure in students with epilepsy include missed or late medication. This is the #1 reason for breakthrough seizures. Please let your nurse know immediately if a student indicates they may have forgotten to take their medication. Other factors: stress, anxiety, lack of sleep, being fatigued, hormonal changes, illnesses, high fevers, alcohol or drug use, drug interactions, overheating and overexertion, and poor diet and missed meals. I've referenced seizure action plans many times throughout our time together, and this is an example of what your school district might use. Seizure action plans will help organize a student's seizure information for you to have whenever necessary. A prepared plan will help you know what to do to prevent an emergency or guide others what to do in emergency situations. By being prepared, seizures or the fear of seizures won't distract you from helping a student. The seizure action plan will include the student and parent guardian information, the treating physician, and any significant medical history, the seizure information such as the type, duration, frequency, and a description of those seizures, the basic first aid, any emergency response, or treatment protocol that needs to happen during school hours. Any special considerations or precautions are also included and is signed off by the physician and the parent. We also encourage schools to use the parent-guardian questionnaire. This allows the parent to provide more detailed descriptions and/or other pertinent information regarding their loved one that may not be included on the seizure action plan. Another useful tool is the seizure observation record. The observation record is used to record information about the student's seizure and can be most helpful to their physician. The observation record includes the name of the student when the event occurs, behaviors before the seizure, was there a possible trigger, their level of consciousness if an injury occurred, what happened during the event, what part of the body was involved, what happened during the post-ictal or recovery period, how long did the seizure last, how long did the recovery period last. Tips for seizure observation. When watching a seizure, try to note what happens in each phase of the seizure, before, during, and after the event. Write down what happens as soon as you can because it's easy to forget the details. And remember that what you see will depend on what type of seizure occurs. And remember, keeping record of any seizure that occurs can be vital information for a family and the physician. Here is an overview of treatment options: anti-seizure medications, epilepsy surgery, the ketogenic diet, and devices such as a VNS or RNS therapy. Anti-seizure medications. Medications can affect everyone differently. Oftentimes, medication side effects aren't taken into consideration, but overlooked, and the student is labeled with an inaccurate behavior. So please discuss medication side effects with your school nurse and report any possible side effects that the student may be experiencing. The ketogenic diet is another treatment option, and it's based on a finding that burning fat for energy has an anti-seizure effect. It is used primarily to treat severe childhood epilepsy that has not responded to standard anti-seizure medication. The diet includes high fat content, no sugar, low carbohydrate, and protein intake. It requires a strong school and caregiver commitment. It is also not a fad diet, but a proven medical treatment, and following the physician's guided plan is essential to the health and well-being of the student. This slide shows a picture of a vagus nerve stimulator. The device is implanted just under the skin on the left side of the chest and has wires that attach to the vagus nerve in the neck. The device is then programmed to deliver intermittent electrical stimulation to the vagus nerve that relays impulses to a widespread area of the brain. The VNS device is used primarily to treat focal seizures when medication is not effective. It also comes with a special magnet. The magnet is swiped over the device, activating stimulation outside of its normal programming and may help to prevent or reduce the severity of an oncoming seizure. The school nurse may provide training on how and when to swipe the magnet to school personnel who interact with students who have a VNS device. Rescue medications. Rescue medications are prescribed for seizure clusters or prolonged seizures. Emergency protocol would include the medication name, how and when it should be given, any specific administration instructions, and what to do following administration. Monitor the response and side effect, and always follow the seizure action plan protocol that is specific to that particular student. Your school nurse will provide you with the necessary information and training of administration of a rescue medication when necessary. One type of rescue med is Diastat, which is a rectal gel. Oral options that you might see are diazepam intensol, lorazepam, or clonazepam. Nasal options include Nasolam or Valtoco. Sudden unexplained death in epilepsy is referred to as SUDEP. Each year, more than 1 out of 1,000 people with epilepsy die from SUDEP. That risk increases to more than 1 out of 150 in people with uncontrolled seizures. While SUDEP is rare in children, it is the leading cause of death in young adults with uncontrolled seizures. While not all students with epilepsy experience difficulty or deficits, some do, and the impact on school and learning can be considerable. Seizures may cause short-term memory problems, and after a seizure, the coursework may have to be retaught over and over. Seizure activity without any obvious physical symptom can still affect learning, and medications may cause drowsiness, behavioral changes, inattention, and concentration difficulties, and some students with epilepsy are more likely to suffer from low self-esteem. Supporting students with epilepsy is vital to maintain physical and emotional health. Here are some tips for supporting students with epilepsy. Avoid overprotection and encourage independence. Include the student in as many activities as possible, and include the seizure action plan in an IEP or a 504 plan, and always communicate with parents about the child's seizure activity, behaviors, learning problems, and all of their successes. We believe all students with epilepsy have a right to an environment where people understand their disorder and where they are accepted and included in all aspects of school life. And for these reasons, we are honored by this opportunity to share our experiences and knowledge with you. Thank you so very much.